Have you ever heard a headache described as a thunderclap? I mean, it sounds intense, right? Well, it's a terrifyingly accurate way to describe a very sudden, very severe medical emergency. So, today we're going to break down exactly what a subarachnoid hemorrhage is, from that dramatic first moment all the way to the urgent race to treat it. You know, this isn't just a dramatic phrase, it's a massive diagnostic clue. When a patient says this, you can bet that alarm bells are going off in any doctor's head. It's the number one way people describe this condition, and it immediately tells you we are not dealing with a typical migraine here.
All right, let's dive into the classic presentation. What exactly is this thing, and how does it make itself known in such a brutal way?
Okay, so your brain isn't just sitting in your skull, it's cushioned by this protective fluid in a place called the subarachnoid space. A subarachnoid hemorrhage, or SAH for short, is what happens when a blood vessel just bursts and starts bleeding directly into that really critical area. This isn't just any bleed, it's a bleed in one of the worst possible places it could happen. And this brings us right back to that thunderclap. Now, what's so wild about this is the timing. Think about it. Most headaches kind of build up, right? This one goes from 0 to a 10 out of 10 on the pain scale in just a few minutes. Another way people describe it is feeling like they've been hit with a baseball bat. It's that sudden, explosive start that makes it so unique and so incredibly dangerous. Well, that headache is definitely the main event. It almost never shows up alone. That blood irritates the lining of the brain, which is what causes that classic stiff neck and a really severe aversion to light, a combo we call meningism. On top of that, people might feel incredibly sick, get really drowsy, or even lose consciousness. All of these are major red flags, pointing to something serious happening inside the head.
With symptoms this intense, the clock is absolutely ticking. And that leads us right into the next crucial phase, the high-speed race to get a diagnosis. So the path to diagnosis is actually pretty clear and direct. The very first thing that happens is an emergency CT scan of the head, without any contrast dye. On a CT, fresh blood shows up as bright white, so doctors are hunting for that telltale sign. But what if the CT comes back clear? Well, if it's been more than 6 hours since the headache hit, a really small bleed might not even show up, and that's when you have to move to step 2. Now, that second step, a lumbar puncture, you probably know it as a spinal tap, is looking for something called xanthochromia. I know, it's a mouthful, but the idea is actually super simple. As red blood cells break down in the spinal fluid, they release this yellowish pigment. Finding that yellow tint is stone-cold proof that there's been a bleed, even if the CT scan couldn't spot it. Okay, so the diagnosis is confirmed. We know there's a bleed, but the next urgent question is, what caused it? The next job is to find the source and fast. 85%. That is a huge, huge majority. Any guesses what this number represents when we're talking about these spontaneous, non-traumatic brain bleeds?
Well, here it is. In a staggering 85% of cases where there wasn't a major head injury, the culprit is a ruptured berry aneurysm. Just picture a tiny, weak, balloon-like bulge on a blood vessel in the brain. They love to form at the forks in the road, where arteries branch off and the vessel wall is under more stress. Over time, it just gets weaker and weaker until it bursts. And that's the moment the thunderclap headache strikes.
So now we know the source. The focus shifts completely to one single thing, securing that aneurysm before it has any chance to bleed again.
Make no mistake, this is an absolute emergency. A ruptured aneurysm is basically a ticking time bomb inside someone's head. The biggest, most immediate danger is a rebleed. It happens in about 10% of cases, often within the first 12 hours. And a second bleed is very often catastrophic. So the goal is to get in there and secure that aneurysm, ideally within 24 hours. So how do you do that? Well, there are two main ways to tackle it. The most common method these days is called endovascular coiling. It's pretty amazing, actually. A specialist threads a tiny tube, a catheter, from an artery in the leg all the way up into the brain. Then, they pack the aneurysm with these super soft platinum coils, which basically blocks blood from getting into it. The more traditional method is surgical clipping, where a neurosurgeon actually opens the skull, finds the aneurysm, and puts a tiny metal clip right at its base, sealing it off from the outside. But fixing the aneurysm is only one part of the battle. Patients need a ton of intensive supportive care. We're talking strict bed rest, good pain control, but also a really crucial medication called nimodipine. Its whole job is to prevent a dangerous delayed complication called vasospasm, where the brain's arteries can suddenly clamp down and narrow, which could cause a stroke.
All right, the bleed has been stopped. But what does that road to recovery look like? And maybe most importantly, what's the one thing you really need to take away from all this?
Yeah, the journey is far from over. Besides that immediate risk of a rebleed, patients have to get over other hurdles, like hydrocephalus, that's a fluid buildup in the brain, and that delayed vasospasm we just talked about, which is a major worry for the first couple of weeks after the bleed. Recovery really means constant, careful monitoring.
And this slide right here, this really shows you the power of modern medicine. Just look at the difference between these two bars. If you leave it untreated, a subarachnoid hemorrhage is fatal in about half of all cases, 50-50. But with fast diagnosis and treatment and a specialist neuro unit, the survival rate skyrockets to 85%. It is just a stark, powerful reminder of why getting to the right place, right away, means everything.
So we end on this question, which brings us full circle. If there's one thing to walk away with today, it's this. The sudden, explosive onset of the worst headache of your life is the one warning sign you should never, ever, ever ignore. It is a true medical emergency, and acting on it immediately is exactly what saves lives.